Good evening and a very warm welcome to all of you in this evening live interactive session of ours where we generally discuss quality Ayurveda with you and we take up important topics with you which are for the benefit of each one of you because we take those topics where we feel that Ayurveda can be of a great help and currently people are not much aware about the Ayurvedic aspect of that particular disease. So coming today to a special disease, we come across to PSP. PSP, which is also known as progressive supranuclear palsy. Now, this is an uncommon disease which now in this era where we know that there are so many stressing factors for people around the globe, the disease is becoming more and more common. So first of all, what exactly is progressive supranuclear palsy? It's an uncommon brain disorder and which causes serious problems with walking, balance and eye movements and later with swallowing also. The disorder results from deterioration of cells in area of your brain that control body movements, coordination, thinking and other important factors. So when we talk about progressive supranuclear palsy, the patients, since they are having problems in swallowing in this disease, so many of the patients when they are suffering from PSP, they develop secondary pneumonia due to aspiration. They aspirate something and since the swallowing reflex is disturbed and then they develop pneumonia and many of them they lose their life also due to that. So when we talk about the symptoms of PSP, the symptoms, many a times the symptoms are confused with the symptoms of Parkinsonism. But once we talk about the symptoms, the first is a loss of balance while walking. The person won't be able to walk in a proper way and inability to aim your eyes properly. Stiffness and awkward movements. The stiffness over here is the axial stiffness as you can see in the image. Unlike Parkinsonism, where it is stiffness of one side of the body, in PSP the stiffness is general, so that the person's complete body looks stiff. So you can see here in the image also, there are problems with speech and swallowing and there is an added problem with light. The person, he becomes very much sensitive to light in PSP. Now moving further with the other symptoms of PSP, the next symptoms which are there in PSP are sleep disturbances, loss of interest in pleasurable activities, impulsive behavior is there, possibly including laughing or crying for no reason. There are difficulties in memory, reasoning, problem solving, decision making, depression and anxiety also creeps in, and a surprised or frightened facial expression can result from rigid muscles. So these are some of the common symptoms which occur in PSP. I have shown the same in image also to you. You can see how the body is stiff. It is the axial stiffness. You can see how the person is having prominent axial rigidity. You can see a retrocolic posture of the body. Along with this, there is a hummingbird sign, which is also known as penguin sign in such people. Now, when we talk about this sign, it is more in the MRIs that this sign is visible. So I won't be going in the details much for it. The causes, the major causes till now are not very much clear, but as I discussed, there is the involvement of the part of certain parts of brain where we see that the parts they get less functional gradually. Now the most important thing is the difference, because I in my common practice see that a patient suffering from Parkinsonism is often given treatment for PSP and vice versa. So it becomes very important that we can differentiate between Parkinsonism and PSP. So the first thing, gait, the movement. In PSP, even at the starting of PSP, the person can fall while walking. It becomes very tough for the person to walk. Whereas in Parkinsonism, the gait remains normal initially. The face is tattled in PSP and is more of masked in Parkinsonism. The speech, it is spastic speech in PSP. The person will be able to speak very tough and very words will come out with great difficulty. In people suffering from PSP, while it will be soft speak, the tone will become lower. In people suffering from Parkinsonism, the most important one, in 10% of people suffering from PSP, there will be tremors, while in 90% people suffering from Parkinsonism, there will be tremors. Unluckily, when people they come to me for treatment, even if I have a look at the allopathic treatment that they are going on, I often see that a person is a person suffering from PSP. The patient says that, see, I am not having any kind of tremors. Still, the medication, the treatment that is being given to the patient is almost the same as is given to a patient suffering from Parkinsonism. The rigidity over here in PSP is axial rigidity, as we just saw that the posture, how it changes, while in Parkinsonism, it is the limbs which become rigid. PSP is a symmetric disease, while Parkinsonism is an asymmetric disease with one part more affected. And that is why when we give levodopa, when dopamine is given, the people suffering from Parkinsonism, they do respond to that treatment. However, the patients who are suffering from PSP often do not respond to dopamine. So we can say that PSP is a disease less known. Parkinsonism, now gradually with time people have come to know about Parkinsonism, but unluckily PSP as a disease is less known. You can see the hummingbird sign which I just mentioned in the brain stem. The image when MRI is done is just like a hummingbird. That is what we call it as hummingbird sign. That is more for the doctors to remember. Now when we talk about PSP, Ayurveda is definitely a pathy of choice, and there is a lot in offer in Ayurveda for a patient suffering from progressive supranuclear palsy. So when we talk about Ayurveda, Ayurveda believes that the Vayu dosha is vitiated in a patient suffering from PSP, and it is the Vyana Vayu which is dushit, along with involvement of Prana Vayu. These two Vayus are vitiated in a patient suffering from PSP. Along with that, there is a demessiation. Dhatu Kshaya is there, and Dhatus, when they go in the Kshaya Avastha, and Vayu, it increases. If we want to reverse that condition, since all Vata disorders are not very easy to cure, so we require initially a Shaman Chikitsa with the administration of Ayurvedic rasayanas like Medhyarasayana and other rasayans. When they are administered to the patient, immediately the further deterioration also stops, and at the same time the patient starts getting good recovery, starts visualizing good recovery. And along with that, when we add Shodhan Chikitsa, like I'll be showing some of the common therapies which we do. You can see over here in the images like Shirobasti is one of them, Dhara is another one of them, you can see over here. Then there is Takra Dhara that is practiced over here in such patients. Along with that, Snehanam is very good. It's a special kind of Snehanam that we do in patients suffering from PSP. And then Sarvang Swedanam with medicated decoction is there. Nasya Kriya again is very helpful in such patients. So there are so many things which we do and which really prove effective in giving a recovery to a patient suffering from progressive nuclear palsy. So what I would like to tell you over here is that, see, progressive supranuclear palsy is a disease which is becoming more and more common in today's era. But if we are suffering from this disease, still the hope lies in Ayurveda. There's a lot that Ayurveda can do in patients suffering from this disease. So if you are suffering from this, if any one of your family members is suffering from it, generally it affects people above the age of 60 years. It's not a disease which will affect younger people. It affects older people more commonly. So if you feel that anyone near or dear is suffering from this disease, you can try Ayurveda, which will give very good recovery in patients suffering from this disease. All that is required from your end is the number is there on your screen. You can share the current condition, you can share the reports and a 30-second video of the patient for our doctors to analyze the patient in a better